Balance family. My name is Janine Jazwiak, the owner of Nature's Balance Acupuncture and Wellness Center, for those of you who don't know me. And today we're going to talk about thermography. October is Breast Cancer Awareness Month, and I don't know, there's something about that just doesn't sit right with me. I think we should be talking about breast health awareness, not breast cancer awareness. We should talk about the health of the breast tissue and what we can do to keep it healthy versus talking about a disease. Now, first of all, to set the stage, when you come here for anything, whether it be thermography or acupuncture or on-demand or sauna, we do not diagnose diseases. Thermography does not diagnose disease. Thermography, actually, what it does is it identifies inflammation in the body. And when it identifies inflammation, that's an indicator that something's out of balance. So that's what thermography does. Thermography is non-invasive, no radiation. What you do is you sit on a chair. We have the camera right here, and you probably can't see that, but you sit on a chair, you take off a gown, and we take your picture. And what it does is, when the pictures come back, we get pictures that have various temperatures. So I have an example here. So here's a picture of breast tissue. So we have the bottom one is healthy breast tissue, and the top one is fibrocystic breast tissue. So blue is cold, green is good and neutral, yellow is getting hot, red is hotter, and obviously white is the hottest. So what it does is, when we take the pictures, there are various patterns that are going to come up in the scan. And some patterns are suspicious and some patterns are not suspicious. So what the doctors who are trained to look at these thermography scans, they're trained to know what particular patterns are suspicious. So your thermal print, or just like your fingerprint, is as unique to you as your fingerprint. So we have to see, number one, is that what does that pattern look like? Are there suspicious aspects of that pattern, or is it just a pattern? So for example, in that example, the fibrocystic was very blotchy yellow pattern, or yellow spots over it. So they're going to determine, number one, what is the pattern? Is it suspicious? And then we need to see, is this pattern stable over the course of time? So the next thing they're going to look at is the heat differential. So between right and left breast, is one breast hotter than the other breast? Is the pattern different between the right and left breast? So they're always comparing it. And then, like I said, they're looking at just heat in general, or the patterns in general. So when they do that, they write up a report. You get all your pictures. So we do front images, we do side images, we do under the breast, and you're going to get your report back. And it's going to explain everything about that particular, what they found, what potentially could be the cause of what they found, and then they're also going to tell you potential options in terms of how to address them. And that's where we come in then. If you're looking to say, hey, we got an issue here, what can we do to fix this? Well, then that's what we do. We work together to figure out how to address the issue that has been identified. Sometimes it's imbalance in hormones. Sometimes it's need more lymphatic brushing. It's various things. So basically they're going to give you some options. It could be liver related, whatever, and they're going to give you some options, and then we're going to figure out what we can do. So the heat is inflammation. And inflammation in the body is good. However, inflammation out of control and on a long-term basis is not good. So if you think about it, if you cut your hand, you have a red spot. It gets red, it gets puffy, and that's inflammation. And what it's doing is bringing more blood, nutrients, and oxygen to the area in order to heal it. Once it's under control, it takes all the trash out, all the waste products from the damage, and the body can then heal it. Okay, that's healthy inflammation. Non-healthy inflammation is the stuff that sticks around with you forever. So basically, it takes 7 to 10 years for a cell to multiply to become the size of a pea. And during that time, it needs more blood, nutrients, and oxygen to grow, continue to grow, and survive. So what we're going to see is heat patterns. Now, this does not mean it's cancer. It just means that it's an imbalance. There's an imbalance in the breast tissue. And when we see that, we're able to do something to address it so that it doesn't go to the disease state. So that's the difference with thermography. What we do, we look at it. and we can pick things up, you can nip things in the bud, basically. So the next thing we do is, like, for example, a lot of people will come again for just breast health. And some people will come for, and they'll want to get a full body scan. And what we do is we do the head, we do the thyroid, the neck, the whole front and back of your body, your feet, your hands, your arms, everything. And we can use that as a way to kind of put a, kind of stake in the ground, and we can say, well, okay, where are we at with this? Once we do an intervention, how did things change? So we can see that and kind of gauge. Now, when we go back to the breast tissue, if we were to do a full body, the doctors would give you a recommendation on when you should come back to have your breasts rescanned, because breast tissue multiplies every 90 days. And what we need to do with that is we need to see, again, as I said, to see if the pattern is stable or not. So depending upon what the doctors will see, they'll recommend anywhere from 3 months to 12 months in order to do as a follow-up for your breast health. And then like I said, for people who want to do a full body, then they're going to give you the recommendation for the breast. And then what we would do is say, okay, what do we want to address? And then maybe we just look at that one part. So if you say, for example, you have knee pain, we're going to look at that knee and just look at the knee and see what happens after we do some type of intervention, whether it be acupuncture or massage or combination of the both, herbs, etc., etc. So anyways, that's what you can do. You can do the breast, you can do the whole body, you can do a body part. And that's one of the things we do here at the clinic is many times we'll be treating somebody and I'm not getting the results I expect. So what I'm going to do is I'm going to say, hey, let's do a little scan and we'll see exactly what we see, because sometimes where the pain is really not the root cause of the problem. So we're going to be able to see, oh, well, the pain is really coming from someplace else. And then once you address that, where that's coming from, you can actually get rid of the pain. I had a patient who came in, and that's exactly what happened. We were treating their knee, and we weren't getting the results we expected. So we did a quick scan. We found out it was referred from someplace else. We addressed that channel, because my teacher would say, find the channels that's screwed up and fix it. So we found the correct channel that was screwed up, and we treated it and resolved the pain. So you can use thermography in many different ways. And it's not just for breast health, but it's also for just a little side point. Women are dying of heart disease very rapidly, and it's a very big, strong risk for women. So, and women's symptoms are very different than men. So when we do thermography, when we do the breast, we can also look at the kind of the heart flow, the blood flow to the heart area. And sometimes, for example, there was a woman who came in and we saw that it was all cold on one side. So there was clearly no blood going to the heart, and she did in fact have some blockages. So we were able to catch that ahead of time. So those are all the ways we use thermography at the clinic. Again, if you have any questions, I hope you found this interesting. If you have any questions, please don't hesitate to reach out to us and give us a call, and we'd be happy to answer any questions regarding thermography or anything else. But just remember, whenever you come here, we're always looking. We're not diagnosing disease. What we're doing is we're diagnosing imbalances, and we're looking to address those imbalances so that you don't ever get to the disease state. Happy October, and have a great day.